Hernias are a bulge, usually in the internal areas or the umbilical area. A bulge can occur there or near any operative scar. In the diaphragm, there can also be a weakness, or in the loin area, a bulge can form. This is what we call hernias. Nowadays, we are placing a mesh into the abdominal cavity or more advanced into the abdominal wall. This procedure is called AWR. In the abdominal wall, we create a space and place a mesh robotically or laparoscopically. This mesh acts as a bed, allowing the patient to recover easily. Hernias can be repaired effectively, and with a mesh, the recurrence rate is very low, and pain is also reduced. Laparoscopically and robotically, there have been many advances in hernia surgeries nowadays.